building those relationships and getting them to go forth and, allocate for you helps me to be able to, not to think I have to be at every meeting, every place at one time. I just can't do it by myself. So I'm a bridge builder. I engage, and delegate. That's how I keep my sanity.
Hi everyone, welcome back to the All Inclusive Podcast. On today's episode, I'm joined by Marcia, Calloway, Chief Diversity, Equity and Inclusion Officer at San Ysidro Health. We discuss the impact of DEI in healthcare and the steps healthcare organisations can take to achieve a diverse and inclusive workforce that advances health equity. Marcia also reflects on her proudest moments so far leading DEI, the challenges she's faced and how she overcame them. As always, before jumping into the video, make sure to hit that subscribe button, turn on your notification bell, and follow on your favourite podcast platform so that you never miss an episode. That being said, let's jump in. Hi, Marcia.
Hello.
Thanks for joining me on the show today.
Thank you for having me. It's my pleasure.
Lovely. So let's kick things off. Tell the listeners a little bit more about you and your journey to where you are today.
Okay. Well, I think my name is Marcia Calloway, but I go by MJ. My pronouns are she and her. And a little bit about me. I currently live in San Diego, California, but I was born and raised in a small town in West Virginia. Not many people would know that about me because I'm definitely a city girl, but I was. I attended Springfield College. I have an undergrad degree in human services and a grad degree in organizational management and leadership. So my professional journey into diversity, equity, inclusion, and belonging started. I was working for the YMCA. I was the director of procurement there, and I started out in creating one of their first supplier diversity programs. And so that's how my engagement in diversity, equity, inclusion, and belonging began. Making sure, again, a community organization, making sure we were engaging with the community and helping the community out because the community were our customers. And then also, I'll say my journey started, my personal diversity, equity, inclusion, and belonging journey started in my first year of college. So growing up in a small town in West Virginia, as I mentioned, predominantly white town, my first year in college was a little bit surprising, a little bit, I'll say impactful because right away, it was a little hard to fit in culturally because my background in culture was coming from a small town in West Virginia. I so much wanted to be and fit in with, the other Black girls who, came from the city, the urban life. And not so much in the beginning. They automatically knew, hey, something's wrong here. She doesn't talk like us. She doesn't dress like us. And I was really hurt by that because I was thinking, well, we look alike, but yes, we look alike, but culturally we were different. So had to overcome that. And I think that is one of the reasons why I do the work that I do today, because of that experience in culture and wanting to belong. So helping people belong in organizations, I guess, stem from that. So, and then as I grew into this journey on DEIB, I got to attend many seminars and webinars to help, my understanding and my education in diversity, equity, inclusion, and belonging. And I went to I guess it was a conference, and early on, and a woman got up and she started talking. I wish I could remember this woman's name because I would go back and thank her today. But she got up and started talking about diversity, equity, inclusion in a way that I had never heard anyone talk publicly before. She started talking about microaggressions and being underestimated, and all the things that I was thinking, at work and experiencing was just coming to the forefront, and tears running down my face because I was like, this lady is up there talking about everything that I've been experiencing, that I've just been, closeted. And she's talking on a stage in front of all these hundreds of people. And I was like, if she can do that, so can I. And that's what started really my journey into diversity, equity, inclusion, and belonging.
Oh, lovely. So, what difference do you see diversity, equity, inclusion making to the healthcare sector?
Well, in my position, I see that in healthcare, everyone is busy. We have San Ysidro Health, where I work. We have over 30 locations, and the physicians, the PAs, everyone is busy. So getting time on their calendars, getting time to educate them is difficult. So that's the biggest thing I see, or I have experienced in the little over 2 years that I've been with San Ysidro Health. That is different from other places that I've worked.
And so, how do you tackle that? What have you found as an effective way?
Absolutely. So I think what I've been doing is, everyone, as we're doing now, everything is video. So e-learning is really the best way to tackle uh, that problem. Um, so in the healthcare profession, there are learnings that they have to do every year to stay accredited for our physicians and as an organization, because we are federally funded. So adding to that list of areas that need to get that they need to be educated on every year annually. I want to add DEIB, diversity, equity, inclusion, and belonging, e-learnings to that. So working on getting a vendor that is can provide e-learnings, but at different levels, because within the organization we have different levels of our workforce that have a good understanding of DEIB. So that's currently what I'm working on, but that's how I've found is going to be the best way to educate our staff. And then we have internal trainers to help us educate our staff in regards to diversity, equity, inclusion, and belonging. So it's a all hands on deck type of strategy to get in front of people and get into their meetings when we can. Because them coming and sitting down for a 2 hour training is not going to happen.
No, I can only imagine. And so, for you, what would you say are the three key steps that an organization, particularly where it's healthcare, as you said, because everyone is busy, everyone and finding time for things is difficult. So, what would you say overall are three key steps that healthcare organizations in particular can take that are really going to allow them to advance their diversity, equity, inclusion goals?
I think one of the most important things is make sure your organization um, is living up to its mission and values. It's they're not just hanging on the walls; they are getting practice in the halls. Um, so no misalignment there. I think three I can think of is data and metrics. So I know you've heard this before because I've watched your podcast, and metrics, data is so important. especially in this arena. And culture, I think, is another one, and resources. So to just break those down a little bit, data and metrics, what you capture is important, and how you report it is also important. And in this industry, we capture gender, age, race, ethnicity. Those are the typical things that we capture. But some less typical things around diversity demographics would be educational level, English as a second language, sexual orientation, compensation level, those type of things that aren't usually captured. Maybe like parent, caregiver, those things that can be helpful in diversity, equity, inclusion, and making sure things are equitable, that some organizations aren't capturing. And when it comes to equity and inclusion demographics, I think most organizations capture like the candidate pool, the internal pool, interview diversity, how many people they interview of color, how many candidates of color they offer a position to, those type of things we can get HR to capture. But some of the less typical things to capture is, who is getting recognized in the organization, like employee of the month or quarter, year, however they do it. And then who is getting public representation, like on social media or in articles, or me like doing this podcast with you. Who are the people in the organization that are getting those opportunities, and who's being asked to speak in public, or speak on webinars, or speak at events for the organization. Those are some things to capture also that may not be typical things to capture. When it comes to belonging, I think, the typical things are the employees satisfaction survey that, most organizations do every year or every other year to try to, determine the engagement of the organization. But thinking about a less typical, like benefit usage, who's using the benefits? PTO usage, parental leave, your ERG memberships, employee resource groups. Are those groups being taken advantage of? What's their memberships like? And even organization event participation. Who's coming to the events? Who's invited? Those type of things. Are we tracking, measuring, or understanding what those look like? So in regards to, metrics, the typical metrics are great, but you have to think as, people say outside of the box. I say think as the box doesn't exist. Think of other metrics that you can measure that gain your understanding of where your workforce is in regards to DEIB. I think also everyone is, a lot of organizations are, really working on recruitment and retention. And that's an area that you asked for 3. That's an area that I think really is a pinch point in not just my organization or healthcare, but organizations around the world. So your talent acquisitions teams really have to be educated on what is going on within your organization in regards to DEIB. So they should understand and be able to talk about, the organization demographics that I just mentioned, the organization diversity statement, if you have one, the diversity goals, the employee resource group information. Do you have a diversity council? What are their goals? So when they speak to hopeful employees or candidates, they can talk about diversity, equity, inclusion, and answer any questions that they may have. We're finding that that's an area that, for me, when I was interviewing, I would ask questions, and sometimes they wouldn't be able to answer me, or they would give a general answer. So I really wouldn't get an understanding of the culture of the organization. So and then are employees being treated fairly? Are you encouraging, as we talked about earlier, training and development? It's so important when you're providing your metrics. Has the organization, a workforce, been educated? Are they going to be held responsible for that education in certain situations? So you kind of have that to fall back on. And organization culture, that's the third thing that I was thinking of. I think, organization culture reflects your organization leadership. People create barriers, not organization. What you permit that goes on in your organization, I think you promote. So policies and practices that have been put in place, early on in the organization, is that still carried on throughout the many years of the organization? Is it, something that needs to be looked at and changed? For example, are our managers and directors and leaders, are they talent hoarders, as I say, instead of talent shepherds? Are they understanding how to grow their staff and how to make sure that they are educating them and pushing them forward to their next position in the organization? And are we recognizing our staff? Is recognition like the cheapest retention or one of the cheaper retention strategies? Are we just put in place, when I started a couple years ago, where we recognize our staff monthly. And the first year we did our physicians, since we've been through this pandemic, our physicians are just wore out. Our nurses, our staff are just wore out. So we recognize our physicians in regards to Black History Month, Women's History Month. So just that alone makes people happy. It also builds relationships because having information, we ask them, where they grew up, why did they get into community health, a little bit about their background. So that helps the other staff, kind of understand them a little bit better. And maybe even find out that, hey, we were born in the same state or the same city, or we like to play tennis on the weekends or something like that.
Yeah.
So, the larger you get as an organization, it's difficult to build those relationships. So that is something else we put in place. So all of those things, working together, help promote diversity, inclusion, and belonging. One more thing I wanted to mention is also your benefits, within your organization. I know I went to a conference not too long ago, and they were talking about benefits. And something they brought up that I thought was really interesting is tuition reimbursement. Now, is that equitable for everyone? Does everyone have the means to maybe go back to school or go to school and pay for classes and then wait to get reimbursed?
Yeah.
Probably not. So is that equitable benefits? Same-sex benefits. I know that some organizations have them, but is that equitable for your employees? Pet benefits. That could help me out a lot.
Yeah.
And then, they also talked about some concierge benefits like childcare backup when, some staff, sometimes they have to call out because the daycare is closed or something like that. So do they have a backup childcare benefit? Or do they provide for some of the parents, their children are the first time going to college, and all the forms and everything online that you have to complete? Is there, can we provide a tutoring for that for our employees? Would that help out? We have also our courageous conversations that we started also when about 2.5 years ago, which has been an excellent way for our executive team to travel to our centers. And we convene the leadership of that center staff and the executive team, our CEO, our senior vice president of operations. They are there listening to the staff. And how it usually works is the staff has a director, and the director has a vice president, and it kind of goes up the ladder.
Yeah.
But here we have the executive team listening to them right there in front of them, sitting at the table, so they can tell the executive team, talk to them, and help them understand what's going great at their center, what they're doing well, how their community has changed since this 3 years or more pandemic, and then areas for improvement and how to improve. So those are some things that we put in place to help with culture.
Oh, fantastic.
I know that's a lot, but
no, I mean, and I think it just goes to show that there is a lot to do when it comes to creating these diverse, equitable and inclusive environments. It's not a simple task by all means, but I think you've given us some really good tools and insight into some of the pieces of work that you're doing that seems to be working, which is great. So in saying that, what's been your kind of proudest moment so far?
The 2 years that I've been here, I've accomplished a lot. I've put in an inclusion council in place. We've added an additional ERG, employee resource group. As I talked about, the courageous conversations, the National Heritage Month spotlights, as I told you about earlier. But one of the things that I think is really exciting that's going on now is the internal medicine residency program we have here. So we received a grant from the American Medical Association called Accelerating Change in the Medical Education Innovation Grant Program. And what I found from talking to our residents, and I talked to them about diversity, equity, inclusion, belonging, and what they've learned at medical school about diversity of your patients and the cultural background, and they said very little.
We're going to take a minute to thank our friends at Dandy, the DEI analytics company, for supporting the show. To drive real change today, DEI leaders need to be strategic and they need to be data driven. That's why today's most successful DEI leaders use Dandy to measure and manage their DEI programs in real time, track key DEI metrics, and create reports at a push of a button. Are you ready to join the DEI measurement movement? Click the link in the description below to download your free essential guide to data-driven DEI transformation.
Very little. So all of that education that our physicians are getting, very little of it is about educating them about different cultures, different ethnicities. So this grant is giving San Ysidro Health the opportunity to educate our residents. So it's so exciting. We've had a indigenous physician come in and talk to them about healthcare, the way that our indigenous people here in California understand it, and the reluctancy, and some of the past practices, as you know, on people of color that really steer them away from going to the doctor to see about themselves and take care of themselves health wise. We also have a educator coming in and talking about our LGBT patients and how to address them, and if we have any transgender patients, how to address if they've had augmentations or not. So this grant has given us the opportunity to educate our residents, and not all of them stay with San Ysidro Health. Some of them don't, but I hope that what they are learning in we have every other Friday, we have an educator come in to educate the class. I hope they take some of this information with them to help them provide the best healthcare possible to everyone that's culturally sensitive and culturally understanding. Just for an example, I had a friend tell me she is Asian, and she took her little boy to the doctor, and we were talking about that. We were talking about physicians and making sure that especially working with people of color, we want our physicians to look like our patients, speak their language. And we were on that subject, and she told me that she thought that was a great idea, but her pediatrician was just someone that was available at the time. And so she took her son there for just a regular checkup, and the physician told her, now she is of Asian descent, so is her husband. So for them, they are of small stature. And so are the grandparents on both sides. So when they went to the pediatrician, and he told them that your son is, behind in growth. He's too little. These are the standards that he should be hitting. And they were all worried, but then, they came home, she told her husband and grandparents, and then they started talking. They're like, well, whose standards are we trying to meet? Are these standards that are,
Right. Yeah.
culturally for our culture,
Mm-hmm.
or are they for just general? So that made me say, really, maybe if they had, someone of their cultural background would understand that, hey, this, your son is doing well, he's healthy, and he may not meet these general standards that we have for children, but knowing your background, your culture, your grandparents, he's well on his way to be a healthy child. So that is a perfect example of making sure that even if the physician wasn't of the culture of the patient, that they know a little bit more about
Yeah. Yeah,
API
it's having that open
patients.
mind. Yeah, I think sometimes it's
Right.
just important to have that open mind and not just be so narrow-minded in terms of, okay, this is what the standard is, this is what an average chart is. I mean, I can remember when I was pregnant with Robin, like my bump was really quite small. And I was like 8 and 9 months pregnant. So I was ready to drop, but my bump was still quite small. And so the midwife, she was like me, she was a black woman. And
Mm-hmm.
I was really worried. I was like, oh, like I've been measuring my bump. I went online. It doesn't say, like, it looks like it's smaller than what it should be. And she said to me, she was like, stop. She was like, tell me, how was your mum when she was pregnant? And I was like, oh, like, or she had twins. And she was like, that's okay. Tell me, what was has she ever told you how she was? And I was like, yeah, like she was, even though she had twins, like everyone said that she looked great. And from the behind, you'd never know that she was pregnant. And yeah, she carried fairly small. And she was like, well, there you go. She was like, trust me, and she measured me out and she was like, you're fine. She was like, everyone is different. She was like, given that your mum was carried small, had a small frame. She was like, your body is doing what it's meant to do. She was like, everything's in order, don't worry. But it was like having that doctor just to verify and just ask the additional question about my background is so important. And I feel like in your example as well, it just goes to show that keeping an open mind, asking some more questions can really make all the difference.
Right. Just being culturally sensitive and culturally understanding, and do a little more research, on your patients. I know physicians doctors are busy, but I feel like that is their role. That is their responsibility to engage with their patients in a way that the, patients feel seen and heard and valued for coming in. Um, so that is one of the things that I'm most proud of that we are currently doing. So we've been documenting and taking photos and recording so we can tell the story to our community that, hey, we are educating our doctors, in regards to diversity, equity, inclusion, and belonging. So they can, the doctors that stay with us or even go to other communities, that they are aware of these things. They're more sensitive. So, yeah.
Oh no,
Very proud of
fantastic.
that.
Yeah, no, definitely. It's definitely something that you should be proud of.
Hopefully we'll get, more grant money to continue the program, but it's been so successful that our head physicians that's overseeing this has put it in their budgets to continue. So I think we're on our way to at least we understanding that they don't get this education in medical school. So and making sure that they understand the communities in which they are going to serve in the best way possible.
Yeah. Oh no, totally. And that sounds amazing. I've got my fingers crossed for you for more grants to come through. But yeah, I think it's ever so important to really educate and be able to provide an even better service for everyone that comes through your doors who need it. So
Right.
Marcia, we know that there's a lot to do with DEI. Like we've talked a lot about different programs, initiatives that are working. But the other part of that is there's a lot to do, and it's a lot to do for one person leading the way, right? So how do you manage everything? How do you stay on top and continue to keep your well-being at the forefront to ensure that you don't kind of avoid that burnout?
Yeah, burnout is real. I have been called the bridge builder because I engage everyone. Diversity, equity, inclusion, and belonging is just not my responsibility in the organization, but it is everyone's responsibility. And so when things come up, when initiatives and events, those type of things come up, I engage lots of different departments. Those that you wouldn't think of, like the IT department. They're always, they're IT, so they just make sure your technology is working fine. But making sure that they are at the table so they can recommend, data analytic tools that can help establish, baselines or for our demographics that we capture. Engaging them in those conversations because they may understand a better way to capture that information, that some kind of program that we already have or we can get. So engaging IT, also engaging accounting. How does accounting help with diversity, equity, inclusion, and belonging? And my thoughts are, hey, I wanna make sure they understand the programs that we are doing and why we are doing it. So then they can be my ally with the CEO says, hey, diversity needs this much, budget for this program. And this is why we think that they need, this should go through. So getting, building those relationships and getting them to go forth and allocate for you helps me to be able to not to think I have to be at every meeting, every place at one time. I just can't do it by myself. So I'm a bridge builder. I engage, and delegate. That's how I keep my sanity.
No, I love that. I haven't heard that bridge builder. That's amazing, and I totally agree. I think the more people that are involved that are able to contribute and aid in this important change, the better. And it's helpful for you. Yeah. So I think it needs to be a problem not just you are solving, but everyone is pitching in to solve. So that's great.
Right.
Well, Marcia, I so much enjoyed our conversation today. Thank you again for joining me. For anyone who is listening, how best can they connect with you?
Sure, they can find me on LinkedIn, Marcia Calloway, Marcia. I think there's a MJ, it's Marcia MJ Calloway, but please look me up there, and I would be happy to engage or help support anyone that's doing this work, because it takes all of us everywhere. And thank you, Natasha, because for having this platform, because this educates and informs lots of people that I would never be able to touch.
Oh, well, thanks again, Marcia. And I wish you all the best in the future.